excited?
Got her binky?
Yeah, you wanna grab the bag? You ready? Are you gonna feel better today? This is Ella Smith.
Hi Ella, how are you this morning? All right, if you'd like to have a seat over here, it's going to be just a few minutes and we'll get Ella on her way here.
She's getting ear tubes put in. She doesn't even know she's gonna feel better. She had back-to-back ear infections. She still has fluid on her ears, so she just needs a little help getting the fluid off of her eardrum, or Ella's gonna have her own kind of speech. She won't be able to hear clearly. We're excited for Ella to be able to hear and feel better again. Uh-oh. And of course you're a little anxious about your child having surgery, but I think Dr. Almaragi's done a good job of educating us, letting us know what's going to happen each step of the way. I chose a facility that only deals with pediatrics. They only see kids. And who better else to take care of your children than someone that constantly sees kids and takes care of them.
We're gonna go around the corner, see how big she is. We'll get you checked in your room, and I'll finish up some vital signs, okay?
All right, sounds good.
Over here to the right.
All right.
Let's see how big you are.
Big girl.
Hi. I'm gonna take her temperature. It's
Okay.
gonna go across her forehead and behind her ear. You guys can come on in. You can set your stuff down on the chairs. Okay, she can keep her socks and she can keep the little toy.
Well, so about 15 minutes from when we leave her till when we see her again.
It'll be about half an hour.
Half an hour, okay.
Yeah,
Where did Ella go? There she is.
How are you, cutie pie?
Sure. The entire surgery takes about a little bit over 10 minutes, and I'll come talk to you when we're finished.
Bye-bye. We'll see you soon.
Bye-bye, Ella.
Hey, cutie.
Don't mind him.
Today's your day?
Hello, everyone. This is Ella Smith. Time in the room is going to be 7:44.
So this is an ear tube. So you can see it's only a couple millimeters, and we implant the tube and it spans across the eardrum. You can see that hole that goes through the tube, and so the purpose of a tube is to keep a ventilation hole in the eardrum. Here's our ear speculum. And basically we just put that very gently in Ella's ear. And the reason we're doing this is just persistent fluid in Ella's ear.
She slept through a fire alarm at school, so maybe now she'll hear that fire alarm.
She's got quite a bit of fluid that's it's going to be suctioned out, and we're going to send this sample to the lab so they can tell us what bacteria has been in her ear. And I usually irrigate out the middle ear with a little bit of antibiotic. I'll take the tube. So this is the ear tube, fairly small. And that'll just ventilate the middle ear. That'll help any infection drain, and that'll allow us to put antibiotic ear drops in her ears if she gets an ear infection. And that is perfect. Ear drops, please. And we're going to move on to the left ear.
It'll be nice to see her and know it's over.
It's the same exact thing, just gently put the speculum in the ear. So we just make a very small incision, probably about a 1 millimeter incision in the eardrum. And that's a complete ear tube. That's ear tubes on both sides.
Are you guys with Ella?
Yes.
They're ready. The doctor's ready to talk to you guys.
Oh, wow.
Gosh, going really fast.
Hey, everything went perfect. So she needed that badly. She had fluid on both sides. This is the only care that you're going to use after surgery. So these are antibiotic ear drops. By this afternoon, she should be good to go. And she did perfect. She did perfect under the anesthetic.
And you think she'll hear a lot better?
She will definitely hear a lot better. I can't guarantee she'll listen to you, but she will hear you. So probably about 10 minutes, they'll call you back kind of once she's awake, and then you'll be able to see her.
All
Great.
right,
All right, guys.
Thank you very much.
Yeah.
The waiting room is behind that frosted glass door.
All right, thank you.
I thought it would take forever, and I blinked, and then they asked us to come back and see him.
I didn't think I was going to be as nervous as I was when I left her, but now that it's over and we've talked to the doctor, it's a sense of relief.
This is Ella. She did fabulous.
Hey, baby girl.
You can have a seat with her right over there if you want to.
Ear tubes function a couple things. They allow us to take a sample of what's in the ear so we can culture it and determine exactly what bacteria it is. But also it provides instant relief for the child that has fluid in their ears. Typically we like to see the child back about 6 weeks out just to make sure that the eardrum has kept the ear tube in and that the ear tube remains open. And from there we see her every 6 months until those tubes fall out. Fast recovery, and ear tubes are a good surgery in the fact that for a patient like Ella, they actually feel a lot better after surgery. Her hearing will be better. She'll have a little bit less pressure in her eardrums.
Look at those cute feet.
There's no such thing as routine surgery. Despite the fact that we do it very commonly, we consider every patient, our most important patient of the day. A patient like Ella, everything has to be perfect, from the anesthetic to the actual surgical procedure. We take it very, very seriously, so we don't ever consider it routine.
She seems happy. She was happy before and after, so that's about as good as it can be.
I knew she was in great hands with Dr. Elmaragi. Nationwide Children's definitely did a great job from beginning to end, very efficient. We got registered, we got back to pre-op. Everyone was very informative. Everyone cared about Ella and cared about us.
Bye-bye, Lila. We'll call you tomorrow.
All right, thank you.
Thank you.
Welcome.
And even as we left, everyone made sure that we didn't have any questions or concerns regarding her or us.